February is Heart Month, a time that's very much relevant to expectant mothers, and a new study shows breastfeeding can reduce the risk of heart disease and stroke for women. And the CDC says heart disease is the leading cause of death for women. In the U.S., Jackie Hake joins us this morning. She's the director of Sanford Family Birth Center and a lactation consultant.
Yes.
Hey, Jackie, thanks for joining us.
Of course.
So you're going to tell us a little bit more about this study. Obviously, there are a lot of benefits. I think most people know there are a lot of benefits to the mother and to the child of breastfeeding, but the new study involved 1 million mothers.
Yes.
Those who breastfed had a lower risk of heart disease and other things as well. So tell me about that.
Yes. So we have been seeing data like this coming out for a while now, but this is by far one of the largest studies and the most long-term studies. They followed women for about 10 years after having a baby. So we have a lot of really great data from the American Heart Association, and it's really showing that any amount of breastfeeding is reducing risks of cardiovascular disease, of heart attacks, of strokes, blood pressure issues, and then not only decrease risk of acquiring these diseases, but decreased risk of dying from the diseases if they occur. So it is just very exciting to see all of that confirmed in such a large study.
And I understand that if, while a mother's pregnant, if she has health issues, maybe pre-diabetes, pre-eclampsia, things like that, that can be impacted as well by breastfeeding.
Absolutely. So there are certain conditions that make somebody at higher risk for continued disease process. So if they have high blood pressure during pregnancy or gestational diabetes, those types of things, they are at higher risk of having long-term effects later in life. And any amount of breastfeeding will help decrease those risks. So not only is it just heart health, but we're talking type 2 diabetes, just a whole host of things, reproductive cancers, breast cancer, ovarian cancer. So any amount of breastfeeding that the woman chooses to do is beneficial.
And now I think that when we think about benefits of breastfeeding on mothers, one of the things we think about is like the weight loss side of it, the other positive benefits, hormones maybe.
Absolutely.
So what have you seen in terms of that?
Yes, well, a woman who is breastfeeding burns more calories than she does when pregnant. And if anybody has ever breastfed a child before, you know that you're hungry like you've never experienced ever in your life. And so that does help regulate your hormones and burn some extra calories, which is never a bad thing.
No, absolutely not. And then, of course, for the child, I know a lot of moms kind of look at breastfeeding when technology's come a long way. Now we have formulas and things, and so some of them are on the line of should I, shouldn't I? For the babies as well, though, it increased or decreased rather their risks of certain things.
Absolutely, and it's really similar things. So decrease of so sudden infant death syndrome, SIDS, that's a big plus. A decreased risk of developing diabetes or heart disease later in their life as well. Decreased risk of obesity. There is a whole host of things for both mom and baby. So it's not, we focus on the baby a lot, but it's really that whole unit that's benefiting.
And I would imagine a lot of us out there probably already have children. If you don't have children, this is a conversation maybe that definitely can help you kind of decide what you want to do either way. But I think it's important to mention, especially as a lactation consultant, that for new moms, maybe you have the idea that breastfeeding is the most natural thing in the world, and the baby comes and it just happens, and there are butterflies and rainbows. And unfortunately, and part of the reason you have a job is because it is not that easy.
And that is exactly what I tell, there's a lot of pressure that we put on ourselves. I'm also a mom. When the baby is born, like I should know how to do this. Again, I would not have a job if that was the case. So we just need to realize that it's okay to accept help, and that it's also okay to have your breastfeeding goals, even if you maybe didn't want to exclusively breastfeed and you wanted to add a little bit of formula in there. There's still all kinds of benefits even for partial feedings. So I think just recognizing that you don't need to put all of that pressure on yourself all the time is very important.
And I think probably valuable to mention as well, some of us, myself included, maybe went into having children with the goal of being able to do this, and unfortunately some of us are just not able to breastfeed, and that's okay.
That's okay.
It's okay. You have permission that it's okay. I know for me, I needed a lactation consultant to say it's all right for you to stop. I know you tried, it didn't work, and that's okay.
I had a similar experience, which is why I became a lactation consultant. I was really struggling, and I had somebody tell me, somebody that I just admired a lot professionally, and she said, all the breast milk in the world is not going to replace good parenting. You are a good mom, and that was exactly what I needed to hear. So I think when we talk about the benefits of breastfeeding, we also, again, it's okay to accept help and take it easy on yourselves, moms.
Yeah. In all cases, take it easy on yourself. All right, stay with us. Coming up after the break, meteorologist Lisa Green is joining us. We'll also have Jordan to give us an update on road conditions.